Assalamu alaikum everyone. My name's Zainab. I'm from the Muslim Council of Britain. We'll just give it another minute or so while we wait for some more people to join, and then inshallah we'll start. Today we have experts from the British Islamic Medical Association and the Muslim Youth Helpline just talking to us about burials, ghusl, bereavement and loss support. And then we have Brother Hassan Patel, who is a former journalist and expert in communications. He'll be talking to us about spotting fake news. Right now we'll have Brother Wajid to start the session with a recitation of the Quran.
Jazakallah khairan. A'udhu billahi minash shaitanir rajeem. Bismillahir rahmanir rahim. Allah subhanahu wa ta'ala says in the Quran, وَمَا يَعْلَمُ جُنُودَ رَبِّكَ إِلَّا هُوَ وَمَا هِيَ إِلَّا ذِكْرَى لِلْبَشَرِ. Allah subhanahu wa ta'ala says in the Quran that no one knows the soldiers of Allah except himself. And this is a reminder, inshallah, to all of us that in two ways. One, that everything that we held to be immutable and permanent has now changed. Everything that we thought was all-powerful has come down to the ground. Whether it's the economies of the Western world or the whole world, whether it is airline industry, whether it's large companies, all of them have been brought to the floor simply by a small virus which we cannot even see. Allah subhanahu wa ta'ala has given us a real lesson in His power and His ability to do what He wills with the world. Sometimes we get carried away with climate change and so on and so forth. And look what Allah subhanahu wa ta'ala has made happen. But you can look at the same ayah in a different way, that no one knows the soldiers of Allah except Himself. And this is true because also you are seeing the people who are getting up and doing things. You are seeing those who are coming together, who are working to deliver food to the vulnerable, who are working on the front lines in the hospitals or in the pharmacists or as nurses. You are seeing those people who are organizing, trying to bring their community together, the imams who are trying to find a way to give spiritual solace to their congregation even though the mosque doors are closed. These are the people who are coming together, and you are also finding those people who unfortunately maybe are not doing the same, who are letting egos and logos and other problems get in the way. So this is a reminder, inshallah, for all of us, that the soldiers of Allah, the ones who are there working and striving in the path of Allah subhanahu wa ta'ala, are all around us. Make sure that we are one of those people, and we are known to Allah subhanahu wa ta'ala, even if we're not known to the people. Make sure that you are one of those people who are not simply taking input of all the negativity that's going on, but you are converting that into a positive output, inshallah. Jazakallah khairan.
Thank you so much, Brother Wajid, and thank you everyone for joining us this morning. As I mentioned, today we'll be hearing from experts from the British Islamic Medical Association who will be discussing burials, ghusl, and financial support for funeral services. We'll be hearing from the Muslim Youth Helpline, who will discuss dealing with bereavement and loss, and then we'll be hearing from Brother Hassan Patel, a former journalist, on how to spot fake news in the COVID era. We'll be taking, each of these sessions will have a question and answer, and we'll be taking all of these questions via the chat facility on Zoom. All attendees will be muted throughout the session so that we can hear all the panelists. So if there is a contribution you'd like to make, please use the chat facility. This session is being recorded and it will be shared on the MCB social media and on the MCB COVID WhatsApp groups, hopefully this evening or tomorrow morning. This session is also being live streamed on Facebook if you'd like to share that link with other people. And the MCB is hosting all of this information on our website, which has the latest guidance on the COVID-19 pandemic. So you can visit that at mcb.org.uk/coronavirus. We also have a number of COVID update WhatsApp groups that you can join to receive updates from the MCB and the partners that we're working with. You can join that by visiting bit.ly/COVID WhatsApp 7. And now I'll hand over to Zara Mohammed, Assistant Secretary General of the Muslim Council of Britain, to start.
Assalamu alaikum, and thank you everyone for joining us again for another Muslim community national update. I think yet again we find ourselves another week into the coronavirus pandemic, and also quite an important time for reflection. I want to thank all of you for joining us here today, and for all of our partners and organisations who are working tirelessly to make a really important and joined effort to tackle this virus, but also to bring everybody together. I think we're seeing, unfortunately, an increasing number of loved ones, relatives, and those on the front line, doctors, nurses, and essential workers, passing away now due to the virus. And obviously, an alternative in arrangements for ourselves because we can't attend these funerals, or finding new ways and new methods to be there and to support family and to support bereavement. So I think really what we're seeing now is an opportunity for us to challenge ourselves, and also to remember that Allah is the best of planners, and Allah is the most mighty and most merciful, and really for us to make a renewed effort to make sure that our community feels supported as well as those around us, and to make sure that we follow the advice that is given and stay at home and support one another through online methods and calls. I think as we begin now to approach Ramadan, a very important month, we will also now need to think about how we're going to make the best of this month in a new kind of time, and quite a surreal time at that. So inshallah, in the weeks ahead, we will be providing some guidance and advice on what we think are some good ways to approach the month. But also for ourselves now, we need to make sure that public health is at the forefront of our mind, and things aren't going to change too drastically. So we need to embrace the opportunity in front of us. And finally, I think that today, and as the days ahead of us go, as well as this webinar shows, it's really an important time for us to think about the good that we can do, and the importance that we can show of faith in action, and representing the Muslim community as part of the national effort. And really, it's amazing to see mosques and community organisations up and down this country, whether it is supporting local food banks or helping your neighbour to make sure they've got the items they need to survive, or the destitute. I think it's making sure we all do our bit, following the guidance, of course, that's been given to us. So thank you again for joining us. Inshallah, I'll pass over now to our first speaker, and we hope, inshallah, if you have any questions or any concerns, please do share them on the chat.
Thank you so much, Zara. We'll now hear from Dr. Mohsen Malik and Dr. Wajid Akhtar from the British Islamic Medical Association.
Assalamu alaikum everyone. Bismillah ar-Rahman ar-Rahim. My name is Dr. Mohsen Malik. I've been part of the BEMA COVID response group and also work with the Muslim Council Wales. So I'm just going to talk a bit about what we've been doing from the burials, ghusls, and financial support perspective, how we've arrived at the decision basically of what our final position has been. So we looked at practice in other countries on what they've been doing for funerals and pre-burial handling, what the medical authorities around the world in the UK have said, what the opinions of the scholars have been, and finally where we come in. So very, very briefly, just some examples of what people have done in other countries. In Jerusalem, obviously the Jewish faith, they decided not to do any washing at all there. In America, in Washington, similarly, no washing. In Ireland as well, direct burial. In the Jewish community in America as well, no washing. Interestingly, interesting a bit, they also call it tahara. Similar in Italy, and even in Muslim countries like Iran, they stopped doing the normal Muslim burial rituals and were doing direct burial. So coming to us then in the UK and around the world, what do the medical authorities actually say? There's a lot of text in there, so I'm not actually going to be speaking about everything here. I've just, it's a lot of medical jargon. I'll just put a lot of it in so people can use it at the point of reference. I've just summarized all the main points. I'm just going to be going through it very briefly, basically, because it's not really the main purpose of today. Public Health England acknowledge that the risk of infection, but importantly, they say it's a low risk. And they suggest that anyone in contact with the deceased should wear PPE and is deemed safe if doing so, as a virus degrades after death. Risk of transmission is due to aerosol production after death. So they're talking mainly about the hospital period immediately after death. And they also believe that any fluid spillage is not a risk, as they believe the virus rapidly degrades after death. Royal College of Pathology, similarly, they also deem it safe if you're wearing PPE. I've just put the red box there because we're not dealing with them autopsy part. Yeah, they say also it's safe provided we're wearing PPE, and they talk about wearing a disposable gown, gloves, surgical mask, and a visor, as shown in this picture. So this is the type of clothing we should be wearing when we are doing any washing with COVID disease patients. World Health Organization, they state until now there's been no evidence of transmission of COVID from the deceased, but they still advise anyone interacting with the body to wear PPE. They stress the importance to deep cleaning after use and having a well-ventilated facility, and they go further and say anyone ill or above a certain age should not have any interaction with the body at all. And furthermore, they advise that anyone handling the coffin is only required to wear gloves, not the rest of the PPE. And finally, ECDC, the European Centre for Disease and Prevention Control, they also say that there's been no transmission of COVID from the deceased. They advise anyone not wearing PPE, they should minimize any direct contact, and they consider sufficient PPE just to be gloves and a long sleeve water-resistant gown. They don't mention anything about eye protection or mask. For standing handling of the deceased, they consider it to be quite low risk, but if there is any chance of any splashing, they do recommend visors and eye protection then. So that's in summary 4 different medical authorities. A lot of similar views. Basically, they all say that it's safe to deal with the deceased provided wearing PPE, and they differ with what they consider to be correct PPE. So what have our scholars said? There have been 3 main opinions. One has been that ghusl is not necessary as they consider shaheed because of the way they've died. Another group of scholars have said that ghusl should not be done because it's not safe. And finally, another group of scholars said it should be done as long as it's medically safe. So where does that leave the community? Basically, you got the scholars who seem to be saying opposing things. So what did we do at BEMA? We consulted the scholars ourselves. We liaised with the National Borough Council, Public Health England, and also specialists in different fields, including infectious disease. And we believe we come to some kind of like happy middle ground, which tries to appease everyone. And we don't think basically the scholarly views are actually that contradictory. The issue mainly seems to be about safety. If it is deemed safe, can ghusl occur? So we produced a short Q&A and a flow chart to follow to determine the course of action. This is a Q&A that we've done. If the risk is low, what is the problem? We wanted to highlight that really that there is still some risk. Some people are saying that there shouldn't be any handling at all. Some people are saying there's non-issue, that people are being overly worried. But there is a risk. People are saying it's low risk as if it's nothing, but precautions still need to be taken. Where on the body does the risk of COVID come from? We mentioned the different areas that possibly that infection can be caused from and why caution is needed. And how can the risk be minimized? And we suggest avoiding any use of any shower or extinguisher spray, which is often used, and also no vigorous handling of the body. What makes ghusl safe? We suggest a well-ventilated room, and that's cleaned properly and thoroughly in between use. What is appropriate PPE? We're following the Public Health England advice that surgical masks and visors are needed during ghusl and protecting the body, as well as the gown and gloves. And we also state that full PPE is not needed for the burial aspect. Gloves are sufficient for when you're actually handling the coffin after any washing is done. What training is needed? We think it's very important to know how to don and doff the PPE correctly, because if it's not done properly, you can actually get infected when you're taking off the PPE. There are videos online, and I think we are trying to get to produce our own on how to do it properly. It is online. Ideally, it should be taught face-to-face by a PPE trainer. It's a very good question. People asking, the worldwide shortage of PPE. Shouldn't we be prioritizing for the NHS? It's a very good question. I guess it's more of an ethical question and above our remit. We believe local authorities should be contacted to check availability of PPE in the area. In my own area in Cardiff, the local authority have said there's enough for the local hospitals and for the faith councils as well. So Obviously, if the pandemic worsens and there is a significant obvious shortage, then this question does need to be looked at, no doubt. Who are high risks? Anyone over the age of 70 and anyone with any chronic conditions, i.e. people who are normally eligible for the flu vaccine. Chronic heart or chest problems, diabetes, etc. The full list is on the NHS website. If the bev is not possible, then local ulama should be consulted on alternative methods. And we've created this flowchart. It's very easy to follow. If you suspect COVID, then is that appropriate and ventilator facility? Yes. Is there PPE available? Yes. Are there adequate number of ghusl performers who are fit and healthy? Are they trained? Yes. And do they have to don and doff PPE? Yes. Then go ahead, perform ghusl. If any of that is not able to be done, then an alternative method should be sought, and you should consult your local scholars, and they can give a better answer for the context of your locality. We stress that ghusl is a normative obligation, and it should be performed where possible. But the Deen, we have mercy in our Deen. We have alternative opinions where it's not deemed safe. We should follow the other opinions there.
Assalamu alaikum. May I just step in for a second on that flow chart? Just something to make aware of. I hope you don't mind me interrupting, Mohsin.
Go ahead.
So some people ask a genuine question, and it makes a lot of sense. They say, look, we don't know who has COVID in the community. Someone could have died of a heart attack, but how did we know that they did not already have the disease? They just didn't have any symptoms. So should we not treat all patients as if they have COVID? And others will say, no, this is extreme. If someone is in the community, they did not have any symptoms whatsoever, they died of a known cause that was definitely not COVID, heart attack, stroke, car accident, nauzubillah, then we shouldn't treat them as if they have COVID. Both of them have their pros and cons, and you can argue both ways. You cannot say that this one is 100% right and this one is 100% wrong for any of them. That's why we want to create a system. We really want the Muslim community at all levels to get out of the habit of 100% of zero or 0% gain, because then everyone has to be a winner and loser. We have to create some flexibility in the system to allow for context and for people's opinions. So if you follow the opinion that everyone should be treated as COVID, whether they die of COVID or don't, because they could be asymptomatic, and if you think that this is what is comfortable for you and your community, then you will go, okay, treat as suspected COVID, and you'll go down this pathway. If you feel that that's an extreme position and that you would treat some people as COVID and some people as not, so you will make the differentiation on if they had respiratory symptoms, if they had some symptoms of COVID but they didn't get tested, then you will go down this pathway. There has to be flexibility, inshallah. If you don't have flexibility, then you're going to break.
Thank you, Wajid. Okay. So are there any other options? There is the option that this needs to be explored. Can the hospital do ghusl? This is occurring in some parts of the country, that you can get the hospital, either the nursing staff or the mortuary staff or whoever, to do the wash before they discharge the body to the burial team. That kind of opinion is accepted by the Hanafi madhab. That's why I'm mentioning it, because the intention is important and non-Muslim can do the wash. It is something that's happening in certain parts of the country. For example, in Manchester, even in Cardiff, we have had early discussions with the local hospitals, and we have a meeting this week, but it does look quite promising. In fact, they went as far as saying, oh, do you want some kind of prayer to be recited? Give us a recording, we'll recite the prayer while we're doing the wash, which obviously isn't necessary, but they were quite accommodating. It's something worth exploring. I'm not saying definitely go down this route, because we have to think about other things. Are we taking nurses away from dealing with living patients? Is this something that is actually manageable? But it is perhaps worth exploring by discussing with your local health teams. I'm just going to touch on this, not really Bima related, but because it's touching on funerals, I thought I'd just quickly, briefly mention it. The government has provided grants for people who are struggling financially. Especially it's relevant if below we have several deaths in the same family, and there is help available. If you go on that website, give.uk/funeral payments, They don't pay for the full burial, but significant contribution related to the person and living in the UK. If you still don't meet any of that criteria and you still need financial support, then alhamdulillah, National Zakat Foundation have advised to contact them for further assistance. Finally, something a bit even less related, there is going to be a webinar, I believe on Tuesday, 8 o'clock, about Nightingale mosques. Basically in Bolton, they've been working with the NHS, and they created a twin 2-bed unit in the mosque, open to all, basically to relieve pressure on the hospitals. They also focus mainly on providing respite care for patients closer to the families in a dignified manner, end-of-life care mainly staffed by local GPs, pharmacists, support workers. If you want to find out more about it, and maybe perhaps something similar in your area, then please attend the webinar, and there'll be a presentation by Dr. Jiva and an extended Q&A open to all. Please let everyone know. Any questions, please feel free to ask.
Thank you so much. I have a few questions, and lots of people have been submitting questions through the chat facility. Thank you so much. And thank you to Dr. Wajid for answering some of these questions in the chat facility. So please be sure to have a read of that. You mentioned that handling a COVID-19 deceased body is low risk. Could you maybe elaborate as to what low risk means?
Okay, Jazakallah khairan for that. This is relative to a case that is high risk. So where does the risk come from a body? The risk comes from anything that produces aerosols, so anything that, like a cough or passing wind or burping, that kind of stuff, anything that produces a spray, that is an aerosol generating procedure or event, and that causes high risk. The risk also comes from feces, from the back passage area. If there's any feces over there, that can cause risk. The risk can come from a spray, water spray. So if you're spraying water from a shower, a stinger spray, and there's a little bit, even fine amount coming off, that causes a risk. The risk can also come from on the surface of the body, whether there has been some COVID there, particularly from areas like the hair. It's a fomite, which is an area which bugs like to be trapped in, that kind of area. So those are the areas that you can get risk. But we know that the infection can live on even on an inert surface like cardboard or a piece of wood. It can live on that for a few hours at least, even up to a day or more. So that's why there is still some risk. That's why there is some risk. It's not no risk. There is still some risk. However, in a standard ghusl procedure where you're simply pouring the water gently, you're avoiding splashes, you are avoiding sprays of water, you are taking extra care on the mouth area and the back passage area, and you're not excessively handling the body, then the risk is minimized to quite a degree. I have to be careful here, brothers and sisters. Different countries, different places have made different assessments. Some say, no, it's all high risk, straight bury, no ghusl. Others say, no, there's no, it's low risk, go ahead as normal. This is a rapidly evolving area, and there's differences of opinion, which is why we need to allow for differences of opinion. But we can't say that there's no risk, but certainly the risk is low, especially, and we can make it even lower if we follow some of those clear guidelines, inshallah.
So does wearing personal protective equipment protect from all of those risks, from most of those risks? And are there any other risks to those, either performing the ghusl or attending the funeral?
The biggest risk, okay, is not from the dead body. The biggest risk is from the other person next to you who's washing the dead body, right? Because that's a living person. And that's a person who could be coughing in an enclosed room, like many of the ghusl facilities are. That's the biggest risk. If they have the disease and they don't know it and they're asymptomatic, that's the biggest risk. So it's the body is there as a risk, but this is the biggest risk. The personal protective equipment that we have, there's a big debate about what is acceptable, right? What level is needed and by whom, and what is available, and what's ethical to use on funerals and what's needed on the front line. There's a big debate about this, and on expiry dates, and which ones work and which ones don't. It's a huge debate. But please don't think that I'm wearing this, therefore I can do whatever I want. I can use the spray. I can, we can have 10 people in a ghusl room because I'm wearing it. I'm immune. You're not. That's not the case. This is all a question of reducing risk rather than eliminating risk. You wear the personal protective equipment. You make sure that you put it on properly. You make sure your arms are covered. You wear your gloves, your visor. You cover your beard. You do all this not to eliminate risk. You do it to reduce it. That's it.
And the UK government updated their PPE guidelines on Thursday. Does your guidance cover this, and is there a need to wear protective eyewear?
If you don't wear protective eyewear, then just go wearing a t-shirt and shorts. Then there's no point. The eye is, there's no, the virus does not discriminate. It will go into the eye and you'll catch it that way. So if you don't have eyewear, if you don't have a shield, a visor shield, then don't bother doing ghusl. You are putting your life in danger. By doing that, you're doing the wrong thing.
And we've had a number of questions about those handling the janazah or volunteers performing ghusl. Could you specifically outline who should not be handling the janazah of someone that has passed away of COVID, and maybe how these volunteers can be vetted, or who should be vetting them?
So this is important. The people who definitely should not be doing ghusl on someone who may or may not have COVID are anyone in the at-risk group. That 70, officially, this is 70 and above in this country. In other countries, it's 65. In another country, it's 60. But let's go by this country's rules, 70 and above. Anyone with a major health condition or on an immunosuppressive drug. And you can find the full list of the high-risk group on the NHS website. Now, a lot of people think that if they're not in the high-risk group, they're okay, inshallah, they'll get it and there's no problems. This is not the case. I have close friends who are in their 30s, healthy, no medical problems whatsoever. They're doctors and they're in intensive care right now. This is, the young people, a 13-year-old died. Yesterday, a 5-year-old died. We know that the majority of people who die are elderly and they have other diseases, but they're not the only ones. So everyone needs to be careful. But certainly if you're in that at-risk group, 70 or over, or any age with a medical condition that's listed on the NHS website as high risk, then you should not even be outside your house. Forget about doing ghusl. What are you doing outside your door? Like, this is not the time to play games.
Thank you. How do we best balance the health of people doing ghusl and the rights of the deceased?
That is not a question for a doctor. That's a question for a scholar or ethicist. I appreciate that. Our job, we have to be careful about what our job is, to tell you what is high risk and low risk and how you can protect yourself. But it's for our scholars and ethicists to tell us the balancing between those rights. And of course, in every community and every scholar, they have to make their own decisions up. People are scared, and it's something, this is justifiable to be scared about. And it's understandable that they're scared, but we also have a right on, the deceased have a right on us. The families have a right on us. I'll give you an example about visiting your loved ones in intensive care. I think there is something brewing right now where, some people say, look, medically the best thing is no visitors at all in intensive care, not one, because it lets the medical team do their job without any interruption, and there's less chance of any transmission of the virus. Medically, that's the best answer. But morally, is it right that a child, 13-year-old, dies by himself, not one family member by his side? Is buried by himself, no family member there? I don't know the specifics of that case, but that isn't the only case. Is it right, like what they're doing in Italy? In Italy, you get one WhatsApp photo when your loved one dies. You're not allowed to come. You get one WhatsApp photo when they die and one WhatsApp photo of the coffin, and that's it. So there needs to be some kind of balance. But who makes that balance? It's not up to the doctors.
Thank you. Could you explain the situation around body bags and whether they still need to be used and whether that's still the government guidance?
Body bags need to be used. I mean, you know, you don't in this country you don't carry a body out, you know, like without covering or something. So a bag is there to protect the public. It's necessary to use them. There was a bit of a shortage, but I just want to make one thing clear. No one will get cremated because they didn't have enough body bags. Like this, that's not a thing. That doesn't happen. The government or the NHS has no right to say we didn't have enough body bags, we're going to start cremating people. That's inaccurate. Now, it may be that some nurse or some doctor or someone somewhere said this because they're using their own logic, but that's inaccurate. You know, if there was a situation where there were, na'udhu billah, you know, hundreds of thousands of people dying and they literally had nowhere, like, you know, then those questions become realistic about mass graves and cremation, all those things. But this is not the situation that we're in. We're in the game of tens of thousands of people. Inshallah, may Allah make it less. So body bags is something that's necessary, but no one is going to get cremated against their wishes. They've already promised that according to the government rules.
Thank you so much. And I know that there was a message that went around earlier this week that went viral regarding cremation and body bags, and I think Brother Hassan will touch on that slightly later when he discusses fake news. I have two last questions for you, please, Dr. Wajid. In your medical opinion, how many people or how should we hold janazah prayers? Should this be kept to a bare minimum? Is there a specific number of people? How can they be performed whilst maintaining safety and social distancing measures?
I think this is one of those areas, it's like so much is, where it's a cross between the scholarly and medical side. From the medical side, we have, again, it's whatever number you have there, you know, they can spread the virus between them. So you can even see amongst the governments, in Germany, they don't allow groups of more than 2 people. In Austria, no groups of more than 5 people. In France, no groups of more than 50 people. So every country, it's like, this isn't science. You know, you're making up the rules. Everyone's making a rule at a number that they're arbitrarily comfortable with. We can't say that this is a number that, you know, you'll be safe with this number, and anything above this number is unsafe. Any number of people that are there, even if they're 2 people, if one of them is got the disease, they can give it to the other person. So all we can say is that whatever number that is there, it should be, one, a minimum. And I think the funeral directors and the National Burial Council are the ones who will know what they can manage. It should be a minimum, absolute minimum. You know, like, this is not the time for the best friend to take a space from the relative. This is an absolute minimum. Number 2, that they should be social distancing while they're there, 2 meters minimum apart. You know, when they're there, they should stand apart. And we saw those the sad images from the funeral of the young 13-year-old Ismail, that people they were praying the janazah prayer not next to each other. They were praying quite distance apart from each other. So to keep them apart. If you're sick, please don't go. You know, because you can spread it to others. You know, I think the one thing I would like to tell everyone is that please don't make one funeral the cause for others. And actually, we have Sheikh Yunus with us, who will probably be able to answer these much better than myself. I don't know if we're able to give him make him a panelist.
Yes.
Actually.
Assalamu alaikum wa
So.
So I think in terms, I just mentioned about the body bags. That viral video that went around, I think there was a few things that was exaggerated. Yes, there are shortages of body bags in the hospitals. We are finding that, but that does not mean that a body cannot be collected without a body bag, because the body's already been moved from the ward to the mortuary without a body bag. So why would the hospital then stop a funeral director from collecting body without a body bag when it's already been moved by the hospital staff from the ward to the mortuary. That's number one. So that's one. And the second one, in terms of funerals, absolutely, I think we've had some cases where lots of people are turning up. We saw the news in Birmingham where over 100 mourners turned up. I think this is irresponsible. I think we have to understand how this disease is spreading, and social distancing, extremely important. Gardens of Peace have now, and Eternal Gardens have now started to only allow 5 people for the funeral. And again, it's going to be arbitrary. I think we just need to be responsible. We just need to be sensible, and it is going to affect individuals in the future. So sometimes we might have to do a live stream rather than doing a recording, because I personally feel uncomfortable doing a recording of a funeral, and that's my own personal opinion. I think even if we can comfort the family to do a live stream of the Janazah Salah, that might be a better option than lots of people turning up.
Thank you so much. From either Brother Yunus or either of the doctors from BEMA, did any of you have any sort of concluding thoughts?
Just what Dr. Wajid and the rest have mentioned, I think the ghusl element, the safety is extremely important. This cannot be any other type of ghusl that we normally do. And I think BEMA did a fantastic job in the chart that they have taken out in terms of looking at the risks. And if we can't mitigate the risks, then you have to go for the other option. But if you can mitigate risks, and I think what we need to do as a community is create hubs in different towns, find the best facilities, either one facility or 2 facilities in one town, and use them as the hub so that we're not putting others at risk. So if the best ventilated facility, the best facility, which is big, which has got the right materials, disinfectants, etc., the PPE, and then we will hopefully be able to manage the ghusl. But if we can't, then we have to go for the other option. Jazakallah.
Thank you so much. We'll now hear from Sister Zora Kaku from the Muslim Youth Helpline.
Assalamu alaikum everybody, my name is Zora Kaku and I'm the director of the Muslim Youth Helpline. Just a quick note on who we are and what we do. We are a national helpline. We've been dealing with calls about the coronavirus for the last few weeks, lots of different issues. So we've created a bit of a resource page, mych.org.uk/coronavirus. I'll tell you a little bit more about the partnerships we've created around helping people through their mental health around this time later on. But just a quick thing of what people have been calling about. This list sort of gets a bit longer and longer every week, unfortunately, but these are just some of the things that people call about. I'm going to go straight through to bereavement, because that's really what we're talking about today. So the biggest thing that we've been dealing with is a lot of support systems. We need to adapt to make sure that the support systems that we currently have or have relied on in the past still work for us, or that we can adapt to have new things that work. So we've just been hearing about things like live streaming funerals and things like that. But I just really wanted to focus on some feelings and emotions and how we might deal with those. So on the screen there you see just a few things that people have been talking about not being able to, not having the choice to be somewhere when your loved one passes away, not being able to be at a funeral, and then also not being able to mourn in the way that we usually mourn. So generally people would be going over to people's homes after somebody in their family passes away, and we're not able to do that. People might even be in quarantine, so they may not even be able to see their own family members, which is really tough. And the last thing I wanted to mention on this is that we're all going through this kind of trauma. Everybody will know somebody who died. For those of us who saw the pictures even of 13-year-old's funeral yesterday and the day before, I think it affects all of us. So even though you may not know somebody personally in your family who's died, we're still all affected by the trauma of all of this that's going on. And it's important to recognize that. Feel sometimes like we're drowning, and I think really what we need to do is try and find some light in this moment. So I just want to talk about those feelings and emotions. It's hopelessness, that you feel like you can't do anything. There's anxiety, worrying about all of these things that are going on in the world and how you fit in. The internal environment has changed because we're all at home, and the external environment has changed almost unrecognizably because everything is different in the world. So your usual coping mechanisms just aren't things that you can rely on anymore. We've been hearing a lot about guilt, things like not being able to be there when someone is dying or when somebody is sick. And that counts for even when you're in a family where somebody's in quarantine, even not being able to give someone a hug when they're feeling low or feeling sick is really hard. Isolation and loneliness kind of go hand in hand. And the last emotion we've been seeing is anger. So sometimes people have sort of misdirected anger, and sometimes it's anger that just at the situation that they're in. But the point is, all of these emotions and feelings are valid. They're all things that you feel. It's not like we can say, oh, well, we can just stop feeling hopeless and stop feeling anger. We need to feel these emotions and these feelings. It's really important to remember that it's okay not to be okay. This is not something any of us could have prepared for. And the way that we're mourning and the way that we're experiencing these losses in our communities and in our families is not the way that we have had to endure at all before. So it's okay to say, actually, I don't know how the heck I'm supposed to get through this. I don't know how I'm supposed to support somebody who's going through this. It's something new, and it's important to remember that. The next thing I wanted to talk about is that we put a lot of emphasis on religion and God and mourning. And because our usual ways of mourning aren't there anymore, we need to think about that kind of expectation that you can go back to some sort of normal life. Because even though you're going back to life after experiencing some sort of loss or grief, you're not really going back to whatever life you had before. It's a completely different time. So religion's given us the guidelines to deal with it. We have a sort of communal way of mourning. But sometimes we don't really think through or allow ourselves to feel that emotion. So for example, if you've lost a father, are you still a daughter? What's your role? It changes. And it's important to remember that the prophet cried, that the prophet mourned. There's no shame in seeking help. The prophetic tradition is actually to feel those emotions and to let that out and to be kind to yourself. And we really need to remember that in these times. It's easy sometimes for us traditionally, I suppose, to just say, well, I'll get through this on my own. I'll deal with this in my room. But actually the prophetic tradition is to experience that loss. It's really, really important. So in terms of expressing emotions, just a few things, ideas of where you can start. Counseling. And with counseling, it's difficult at the moment, of course, because we don't have face-to-face sessions anymore. But if you don't know where to start with that, just contact MYH. We're really happy to refer you to professional counselors, bereavement counselors, anything that you need. Online and social media has become a bit of a, I was going to say haven, but really it's probably not a haven. It's probably a coping mechanism for all of us in terms of being able to express your anger, express your emotion, your upset. Social media is social. That's the point of it. Posting things up on Facebook, on Instagram, wherever you are, is worth doing if you feel like sharing. Writing is something that's, I suppose people are starting to do this a little bit more at the moment because they're in isolation and can't really go out and talk to their friends, but writing is important. Talking to whoever you can, whether it's your friends on social media or on Zoom or whatever it is. And the last two things, knowing where to go is one thing. So at the point at which you feel, actually, I can't handle this, I don't know what to do, all you need to know is one place to go to. So again, MYH is a good place for that because we're really happy to refer you on to where you need. Helplines are really in their element at this moment in time and very busy, and rightly so, because at the point in which you feel like you have no hope, somewhere like the Samaritans or MYH are a very good place to start. And the last thing there, in terms of expressing emotions, is actually crying. There are points at which we are all going to feel like it's just overwhelming and you just need to let it out. And that's a really important thing to allow yourself to do. Let that happen. In terms of signposting, I just wanted to put up two particularly relevant resources. One is the Macmillan support line. So for those of you who don't know Macmillan very well, Macmillan, although they handle a lot of cancer care, they do a lot of end-of-life care and loss and mourning and bereavement. So the way their support line works is you call them, there's a helpline worker who can help you through emotions, but they can also refer you to telephone counselling, professional bereavement counselling for free on the phone. So that's really, really useful. And the second resource there is the Macmillan Community Forum, and that's where you can go online any time of the day or night and speak to other people who are going through loss and mourning. So it's a really important place that you can go to for support. Just to kind of finish off, just to let you know, in terms of mental health and all of these things, there are a few organizations that particularly work on mental health from a faith and culturally sensitive perspective. So all of us that you can see online there on the screen are working towards making sure people have the resources that they need. Please feel free to get in touch with any of us if you need anything. And lastly, just to put up there, just to remind you, mych.org.uk/coronavirus, we're putting up as many resources as we can from other organizations and also from ourselves around mental health and bereavement and loss, and really just trying to get through the trauma and coping through all the things that we're going through at the moment. That's it. Thank you.
Zora, thank you so much. Could you clarify whether MYH is a helpline that's only for those under the age of 18 or whether it's open to anyone?
Sure, thank you for asking that as well. So we're called the Muslim Youth Helpline because we focus on trying to get youth to open up to us, but really it doesn't matter how old you are, you can get in touch with us. I think our oldest ever caller has been in their 70s and it's absolutely fine. We're still there to provide faith and culturally sensitive counselling support to anyone who needs it. So you don't need to be under 18 at all. Any age is fine, and any issue. The main thing to know is that our support is completely non-judgmental. So whatever's going on in your life, and confidential, whatever's going on in your life, please feel free to call. The only other language we provide is Gujarati on the phone. But if you need counselling or support in different languages, we're really happy to signpost you to other services who can do that.
Thank you so much. I think as Brother Wajid has mentioned in the chat facility, there are lots of other mental health organisations in the Muslim community also providing support and working with Muslim Youth Helpline and other organisations to best support Muslim communities at this time. We'll now have Brother Hassan Patel, a former journalist, who will discuss some of the fake news that we've seen around the coronavirus.
Okay, Assalamu alaikum warahmatullahi wabarakatuh. My name is Hassan Patel. I used to work for the BBC and Al Jazeera many years ago. Now I'm leading communications for the University of Birmingham. Something that the group were discussing recently a lot was the sharing of unverified content, unverified news, and more or less fake news, which, to be fair, we've all received, and no doubt many of us have even forwarded on without actually checking the facts for it. So what is fake news? Well, according to the Oxford Dictionary, it's a false story that appears to be news, spread on the internet or using other media, usually created to influence political views or as a joke. I would modify this to actually say usually created to influence views or as a joke. We've seen recently a surge of information, and fake news was more linked to political campaigns, for example, in the past, but this is the first time a health issue has come up to the forefront, and where so much information is out there that we can't exactly clarify what is right and what is wrong. And at the end of the day, for example, in any presentation, if someone sees something like this, how can you verify it or not? Don't believe everything you read on the internet just because there's a picture with a quote next to it, quoted by Abraham Lincoln in 1860. Okay, an example of fake news, but it's trying to get that point across that these days we can't exactly separate what's fake and what's not fake. So I'm going to give you a few examples of fake news. I'm not here to malign any individual or name and shame any person per se, but just show examples and then show how we can combat that and what we should do as well. I've just got to, sorry, apologies there. Let me just put it back up. Just bear with me for one moment. There. Okay. So this particular story here did the rounds last week, not just in the USA, but in the UK. A doctor apparently had a successful treatment for coronavirus, and apparently even the White House were supporting him, and Israel, for example, were going to consider this cheap protocol. Now, WND is a hard right-wing news outlet known for its fake news. Only yesterday, I was on that website and they were accusing the Democrats of just raising money for Black people and Latinos when it comes to vaccinations. Now, this particular article was the 5th most shared article on COVID in the UK in the past week alone. Think about this. COVID-19, news is 24 hours constantly on it, yet this was the 5th most shared article in the United Kingdom alone, an article from the USA. 160,000 engagements on Facebook during a 24-hour period. The published article was on the 25th of March. If I want to give you context, that was more than all of the NHS website engagements that they received from Facebook and Twitter during the past 30 days. One story like this, doing the rounds, someone allegedly having a cure, not verified. However, at the same time, it has enough information there that people are sharing blindly, and it's more powerful than engagement rates for the NHS website. This is the kind of news, fake news, that we're dealing with. This one, I think I received from members of my family and friends. Just one snippet of it. It's information that's apparently from an expert from Stanford Medical College. Our medical friends will probably tell you that Stanford Medical College is pretty well known and has done some great work in advancing the medical cause. But this particular story was that if you just, how do you say this? Cough once in a while, you'll probably figure out if you have coronavirus or not, or if you hold your breath for 10 seconds without coughing, that can also tell you. Now, this particular fake news story was denied by that particular university, and all the stories that this post was highlighting has been deemed inaccurate by the government. Now, the simple fact is, why are you forwarding something on when there's no substance to it? If you want that information, just log on to the nhs.uk/coronavirus or speak to experts. But these are the kind of difficulties we're facing. We can't clarify what's genuine and what isn't. Just 2 examples of something that I've received over the past 48 hours. 5G. Apparently it causes coronavirus and it's doing the rounds. It's been rebuked from politicians, from experts, but somehow the WhatsApp warrior knows more, or the individual who puts his phone next to a radiation marker and tells us that, look at this mast, it has so much radiation, not knowing that his phone may have caused that radiation as well, or should I say airwaves. So again, a good example of fake news. This was sent to me recently, and we were looking at examples of fake news. The second one, just heard 12 COVID cases died last night in Norfolk Park Hospital. All were Indians. Avoid going to Indian shopping bazaars, very loaded. You would always find particular comments, statements very loaded, and that's something that I'll probably mention later on as well. So again, examples of what we're receiving. With all the facts, you get the fiction. This something, I'm not going to play the video, but this was a video that was shared last week, and it's allegedly a mosque in the Small Heath area of Birmingham. People were coming and going, and coming in and out of a particular mosque, and this was doing the rounds, and it got actually coverage in some of the local media, but on the social media it just flew everywhere. Now the fact was, this was not true. This particular film was done before the date that it highlighted, and actually that particular mosque was in lockdown and has been shut since, if not before, the 23rd of March. But the pressures that this kind of fake news then causes is that it gets journalists involved, it gets the policymakers, politicians, the police involved, and then resources that can be focused elsewhere are just wasted on these particular stories to rebuke. So West Midlands Police had to issue a statement saying that this footage was filmed in Small Heath. However, at the same time, they can confirm that the mosque has not since been opened since the restrictions was announced last Monday, 23rd of March. But again, forwarded on blindly. The number of people that send me this, have you seen this? Have you seen this? No facts whatsoever. So we have all these elements of fake news. how can we deal with fake news? And that's the difficult thing. However, some basic things to consider. When you receive something, consider your source. Is it a news story? Is it a random share? Has it been attributed to any particular organization? If information is true, it always comes from a valid source. What are valid sources? The World Health Organization, Public Health England, NHS England, BEMA, MCB, verified individuals or organizations who have some weight in what they're saying, rather than my cousin or my friend down the road. Now, these bodies, their job is to basically provide information, collate information, interpret data, and give us the right news, rather than just stuff sent about how to gargle and you'll be fine, for example. Avoid tabloids and news sources which are known to be inflammatory. Breitbart, WND, these kind of conspiracy theorist websites, for example. Also check where it was published, check the language, look at loaded terms. For example, the WhatsApp message where it highlighted avoid Indian bazaars. That's a loaded term. It's basically saying Indian people or Muslim people to a certain degree are the carriers of COVID. Number 2, cross-check. Is this only one source reporting? And I don't mean you cross-check your WhatsApp group to see if all your friends are sharing the same particular content, but cross-check in the sense of looking at what you're seeing. Is this information different but worded similarly elsewhere in another news outlet or another platform? I always say that if something isn't reported on multiple platforms, it's not true. Something you receive a message on WhatsApp, however, it's not on Facebook, or it's not picked up by a news outlet, or it's not verified by a reputable organization, good chance it's not true. Just a few days ago, and number 3, checking the date, I received something which was sent in February of this year. And again, our medical friends can back me up here. COVID-19 is an evolving illness. It's a disease which is new in a lot of aspects, but it's evolving, and treatment options, diagnostic criteria, health policy have all changed so much from February to March to April, and no doubt it will change again. So what may have been relevant sometime in February may not be relevant today. So again, check your news, check the date, check when it's done. Now, for someone who used to work in news, I can honestly say one thing to you. The headline is what matters. That's what pulls people in. Even in the comms perspective, it's what pulls people in. And shock does sell. That's a fact. The media is designed to get you to click, read, engage based on its headline. But do me a favor, read the full story. Don't just look at the headline. Don't just look at the person getting carried away in a video. Verify. There may be some element of truth, for example, in some of these messages. However, there could also be a lot of false as well. So look beyond the headline. Look beyond the first 5 seconds of a video. Watch it, read it. Watch it, read it, and take it from there. And then also at the same time, when you read it, you kind of then check it, you check the date, you consider the source. It's a kind of a circle that you have to constantly do. Now, if you're considering forwarding something on that you received, think about how it affects others. Would you like me to forward some false news about you just for the sake of forwarding it? I've got a friend, and it's getting a bit of a running joke with him. He tends to forward things so quickly, and then someone tells him that is wrong, that all the people he's forwarded it to, he'd have to delete it and apologize. And I just say to him, I go, why do you do it? You don't have to be the first person to break that news. There's no competition. It's just being factually correct. So if you are considering forwarding to others, ask yourself some questions. Is this information helpful or hopeless? Does it inspire? Does it instigate? Is it educational or is it agitating? The aim is to help others by sharing information, to share knowledge, not to make the information overload worse. And for example, sadly, my hometown of Walsall, recently we've lost a sister who passed away. She was a nurse just a few days ago, and we've seen the news coverage about it. But last Sunday, we were receiving messages that she'd passed away. And the irony was one of the imams of the mosque was on the phone to her brother or her husband, not quite sure, and he had to call back to say, "I just received this news," and he said, "Well, no, she's still alive. She's in ICU. Please pray for her." But the damage it can cause to individuals, the damage it can cause to any aspect in this particular time is very, very detrimental. And finally, and this is something that I do, and I'm not embarrassed about this, call it out. If something is fake and you receive it and you know it's fake, and you've done your due diligence, go back to that person, tell them this is wrong. Whether it's in a WhatsApp group, whether it's amongst friends, of course, in a respectable way, rather than being personal, but call it out, because you can stop the spread of misinformation, which at this moment in time we're seeing constantly growing and growing. The government is spending a lot of money and resources, for example, in debunking all these myths. Not that many of you received these fake WhatsApp messages allegedly from the government. Again, the government had to then do another campaign to highlight what was genuine and what wasn't. Again, difficulties that resources can be spent elsewhere. Now that you've seen this, and this is just a kind of a summary of what I've just said, consider the source, cross-check it, check the date, read beyond it. Don't just forward any and every message. This isn't a race, and quite frankly, forwarding things doesn't make you a genius in the comms of the media world. It's all about being factually correct. And also, don't give in to the panic. Spreading panic in a time of fear is common. Follow every step that I've highlighted above, and we can take it from there. However, this presentation, I could have just had this particular slide and just spoke about this. This is a verse from the Quran in Surah Al-Hujurat. Allah subhanahu wa ta'ala says, Ya ayyuhalladhina amanu in ja'akum fasiqun binaba'in fatabayyanu an tusibu qawman bijahalatin fatusibu ala ma fa'altum nadimin. O you who believe, if an evildoer comes to you with important news, verify, lest you should harm people in ignorance out of haste in belief and making decisions. And afterwards, you become regretful for what you have done. And that's a simple element as a Muslim. You just have to focus that, do not spread misinformation that you don't know if it's true or not, verify it, and then do it. And also, finally, there's expertise. There are individuals who are working around the clock, whether professionally or in a volunteer aspect at this moment in time, doing and sending and highlighting the right information. The NHS website, go onto it, check it. Our friends in Bima, the work that they're doing, and of course the MCB. Follow them on Twitter. Contact them if you feel that there's something that you have received and it's not true. They may be able to give some advice as well. Fake news is not going to go away. It's going to continue, and it's going to grow and grow and grow. But we can probably help a lot of individuals by just having a bit of due diligence, using common sense, and above all, just verifying ourselves, checking ourselves. And if you're not sure, don't forward it. Don't clog my inbox or WhatsApp group or anyone else's for that matter, if we don't know if it's true or not. Jazakallah khair.
Thank you so much, Brother Hassan. If I could just bring back in Zora Karkul from Muslim Youth Helpline really quickly to maybe just discuss why people might be forwarding it and the psychology behind that.
Sure. So I think you probably need to get a psychiatrist or psychologist really to answer that question properly. But I think the main thing to mention here really is that people are really looking for comfort. These are unprecedented times. Everybody is scared. Even if they say they're not, everybody is scared. And so people are trying to find whatever comfort they can, wherever they can. So I think it's important that we don't vilify people. I think all the tips that we just got are really important, and it's worth maybe sharing those every time you receive something that looks like fake news, maybe helping to educate other people. But really, they're all just trying to find some sort of comfort.
Thank you so much. I think that kind of highlights it all. If we could just bring back in Zara Mohammed, Assistant Secretary General of the Muslim Council of Britain, to close.
Yeah, thank you to all of our presenters for some really important insights into what's going on. And I think the key message and take home from today is that we need to verify our sources, and we need to be calm about what's happening around us, and to make sure that we check our information before we share and before we send. subhanAllah, with the hard work from the different organizations in the Muslim community, medics, scholars, and practitioners, we now have guidance on burials. We now have dynamic guidance that is being produced. So for those of you involved in that area of work, please contact the people that are, leading, who are working with local authorities. I know a lot of masjids have already had meetings and continue to have meetings. And I think more fundamentally, please do not physically go and attend these funerals unless you have the permission, you meet the criteria, and you're following the guidance. This is a time for us all to keep safe and to make sure that we are really paying heed to this guidance. It's not for the sake of it, and the threat and the danger is really real. Obviously, it's really important to think about the well-being of our friends, our families, and those who are also quite isolated right now. There's lots of calls for volunteers, whether it's the NHS or local organisations, whether it's just to make a phone call to those individuals or even just to your own family members. I know lots of people are doing Teams calls or Zooms call, social calls, which is quite a nice way of going around things. And then finally, I think on the point of fake news, I think it is really fundamental that we take responsibility for our messaging and for also what we are kind of consuming from those messages. And it's important to be merciful and to have compassion. When people are scared, they do have that frenzy, and we saw what happened, a few weeks ago with regards to cremation. So I think just taking our time and to remember that this is the month of Shaban, and really an opportunity for us again to, focus on worship and focus on reflection and self-improvement. And we actually live in a time where we have so much access. So really we should make the most of it and obviously enjoy the time we have with our families as much as we can. I'm sure many of us are taking it for granted how much free time we had when we weren't at home and enjoying our social life. But thank you again. Obviously this webinar is recorded and it will be shared. If you'd like to support the work of MCB, please have a look at our website and Friends of MCB. You can join in our activities, you can donate, and you can find other information that is helpful with regard to this. Thank you, Zainab, for chairing the meeting and for everybody else for attending. If we haven't been able to answer your questions, please do message them or email them in and we'll do our best. And again, thank you all and take care, inshallah. Assalamu alaikum.
Thank you so much, Zara. And I'd just like to reiterate the contact details and how you can keep in touch with the work of the MCB and the work of all of our partners in this. We are hosting all of this information on our website if you'd like to visit mcb.org.uk/coronavirus. And if you'd like to also follow us on our social media pages on Facebook, Twitter and Instagram, where all this information is hosted. And we also have a WhatsApp group which in which updates are regularly provided, and you can join that by visiting bit.ly/COVID WhatsApp 7. Thank you so much to all of our panelists and to all of you for joining. Assalamu alaikum.